20 minutes, 30 minutes, sometimes longer, sitting there, gripping the sides of that seat, bearing down with everything you have, feeling the pressure, feeling like something is right there, and then nothing. You stand up, you walk away. And 2 hours later, you are back in that same bathroom, trying again, getting the same result. If that is your life right now, I need you to stop and listen to me very carefully. Because what you are experiencing is not constipation. It is a physical blockage forming inside your body, and it will not resolve on its own. It will get worse. And right now, somewhere inside you, that process is continuing. There is also one mistake, one specific, completely understandable mistake that millions of seniors make the moment this happens, that takes a serious situation and turns it into a medical emergency. I am going to tell you exactly what that mistake is before this video ends, and I am going to give you the step-by-step protocol that could resolve this tonight, at home, before it ever reaches that point. My name is Dr. Clifford Adeshina. For over 2 decades, I have dedicated my life to one mission, giving adults over 60 the health information they deserve to have but rarely receive. Not because doctors are hiding it, not because the system is corrupt, but because a 15-minute appointment was never designed to cover everything that matters. This channel exists to fill that gap, with honest information, with real research, with the kind of clarity that puts you in control of your own health. This is not a channel for generic advice. This is a channel for the truth that changes how you live, and it starts right now. In over 20 years of medicine, I have watched adults suffer in silence for days, sometimes weeks, with a condition so dangerous and so misunderstood that the very thing they did to try to fix it made everything dramatically worse. By the time this video ends, I am going to show you exactly what that thing is, why it is so easy to fall into that trap, and what you must do instead starting tonight. Let me be direct with you from the very beginning. There is a critical difference between constipation and what I am describing today. Constipation is a slowdown. What I am talking about is a blockage. Stool that has become so hard, so compacted, so dehydrated, that it is physically wedged inside your rectum, and it is not moving. The medical term is fecal impaction. And if you are over 60, the odds that this is either happening to you right now or has happened to you recently are far higher than most people realize. Researchers have established that fecal impaction disproportionately affects adults over 65, with rates in long-term care settings reaching as high as 40%. Nearly 1 in 2 older adults in residential care. And those are only the people who have been formally identified. The numbers in the general community are harder to count precisely because so many people suffer in silence, assuming what they are dealing with is ordinary constipation, assuming it will resolve on its own, assuming they just need more fiber or more water or more time. It does not resolve on its own, not once it has reached this stage, and time does not help it. Time makes it worse." End quote. Stay with me through the next 4 minutes, because the mistake I am going to show you is one that almost nobody catches in time. Here is why this happens. Your colon is designed to absorb water from waste as it passes through. That is its job. That is what it does every single day, without you thinking about it. But when waste moves too slowly, when it sits in that colon for days longer than it should, the colon keeps doing its job. It keeps absorbing water. And the stool that should have been soft enough to pass becomes drier, harder, and more compacted with every hour that passes. By the time it reaches the rectum, it is no longer stool in the way you think of it. It is a dense, rigid mass, and it is stuck. Most people watching this right now have had no idea that process was happening inside them, and that is exactly what makes this so dangerous. I want you to picture something. Imagine a wide, slow river running through a valley. For years, that river flows beautifully. The current is steady. Everything moves. Now imagine that over the course of several weeks, the rains stop coming. The river slows. The water level drops. And at one particular bend, a narrow section where the current was always a little weaker sediment begins to settle. Day after day, that sediment compacts. It hardens, until one morning the water can no longer push through. The river has not stopped entirely, but at that one critical point, nothing is moving anymore. That is your digestive system. That narrow bend in the river is your rectum, and the sediment that has hardened and blocked the flow is stool that has been sitting there far too long, losing moisture, losing softness, transforming into something your body no longer has the mechanical force to expel. After 60, 3 things happen simultaneously that make this process almost inevitable without the right knowledge. The muscular contractions that push waste through the colon slow down with age. The nerve signals that coordinate those contractions become less precise. And the body's ability to register thirst decreases, which means many older adults are chronically mildly dehydrated without ever feeling thirsty. Less movement, less precision, less moisture. The result is stool that arrives at the rectum already partially dehydrated, and a rectum that does not have the muscular power it once had to push it through. Now add medications into that picture. And this is where it gets serious. Blood pressure medications, iron supplements, calcium channel blockers, certain antidepressants, opioid, pain medications, antihistamines. These are among the most commonly prescribed drugs for adults over 60, and every single one of them has constipation listed as a direct side effect, not a rare side effect, a common one. If you are taking 2 or 3 of those medications simultaneously, and many of my patients are, the combined constipating effect on your digestive system is significant. It is compounding. And for many people, it is the hidden engine driving everything they are experiencing right now. A study published in Alimentary Pharmacology and Therapeutics found that adults over 65 taking 5 or more medications simultaneously faced a significantly elevated risk of fecal impaction compared to those on fewer drugs. I want you to think about your own medication list right now. Count them. How many are you currently taking? Because if the answer is 5 or more, and you have been struggling with your bowel movements, the conversation you need to have is not about laxatives. It is about that list. Write that down before this video ends. I want to tell you about a man I will call Desmond, 71 years old, retired school teacher, a man who by every measure was doing the right things. He walked every morning without fail. He ate oatmeal for breakfast. He took his medications faithfully. He was the kind of patient every doctor appreciates, disciplined, attentive, never one to ignore his health. He told me once, sitting across from me in my office, "Doctor, I am not the kind of man who lets things slide." About 4 months before I saw him, something began to change. His bowel movements became less frequent, every other day instead of daily, then every 3 days. He adjusted his diet, added a banana, drank an extra cup of tea, told himself this was simply aging, that his body was changing, that it was manageable. What Desmond did not know, what no one had ever told him, was that one of his blood pressure medications, a calcium channel blocker he had been on for nearly 2 years, had been quietly slowing his intestinal motility the entire time. And because his sense of thirst had diminished with age, he was chronically underhydrated despite drinking tea throughout the day. His stool was arriving at the rectum already dehydrated, and there it sat, hardening, day after day. Until the morning, Desmond realized he had not had a complete bowel movement in 11 days. He was straining for hours at a time. He was exhausted, and then he developed something that confused and frightened him, unpredictable liquid leakage, without warning, without control. And here is where everything changed, not for the better. Desmond looked at that liquid and made the most logical conclusion in the world. He assumed he had developed diarrhea, so he went to the pharmacy. He bought an anti-diarrheal medication, and he took it faithfully for 4 days before he finally came to see me. That decision, made with the best of intentions, made out of genuine fear and genuine logic, very nearly turned his situation into a surgical emergency. I will explain exactly why that is in the next few minutes. But I want to tell you how Desmond's story ends first, because he did get better, completely. Once we identified the medication driving his crisis, adjusted his regimen, and walked him through the right protocol, his bowel pattern normalized fully within 6 weeks. No surgery, no emergency room. And the morning he called my office to tell me, I still remember exactly what he said. He said, "Doctor, I feel like myself again. I did not realize how long it had been since I felt like myself." That is what the right information does. That is why you are watching this right now. If what I have shared so far is already resonating with you, I want to ask you to subscribe to this channel right now and turn on your notifications. Not as a favor to me, but because what I just shared about Desmond, the medication connection, the protocol that resolved everything without a single emergency room visit, is exactly the level of information this channel delivers every single week. Your health deserves this. Subscribe now so you never miss it. Now let me give you exactly what I promised, the complete picture, what is happening, what you must never do, and what you must do instead in the right order, starting tonight. The first thing every senior must understand, and I need you to hear this clearly, because it is the most counterintuitive and most dangerous piece of this entire situation, is that what looks like diarrhea may not be diarrhea at all. Let me slow down here, because this moment matters more than almost anything else I will say today. When a hardened mass is blocking your rectum, your intestines above that blockage are still producing waste, liquid waste, and that liquid has nowhere to go, so it does the only thing it can do. It finds the edges. It seeps around the outside of the solid mass, the way water finds the crack in a dam, and it leaks out, unpredictably, without warning. If that is what you have been seeing, stop, because what you do next will either begin to resolve this or make it dramatically worse. It looks exactly like diarrhea. It feels like diarrhea. Every instinct you have tells you it is diarrhea. It is not diarrhea. It is called overflow incontinence, and it is your body's last desperate attempt to manage a blockage it cannot clear on its own. A study published in the Journal of the American Geriatric Society found that overflow incontinence associated with fecal impaction was among the most frequently mismanaged gastrointestinal conditions in older adults, and that the most common error, by a wide margin, was the use of anti-diarrheal medication. When you take an anti-diarrheal drug in this situation, you are telling your intestinal muscles to stop moving. You are shutting down the only mechanism your body has to work around the blockage. You are not treating diarrhea. You are cementing an impaction more deeply into place with every single dose. This is exactly what Desmond did for 4 days, and it is the mistake I am asking you directly, personally, never to make. If you are experiencing liquid leakage alongside days of being unable to fully empty, do not treat it as diarrhea. Do not go to the pharmacy. Call your doctor first and describe exactly what you are experiencing. Now, the second thing you must understand is that straining harder will not solve this. And in adults over 60, straining harder can cause genuine and serious harm. I know what your body is telling you. Push harder. Try a different position. More effort. But a dehydrated, compacted impaction does not respond to pressure the way normal stool does. Every additional straining effort increases your risk of hemorrhoids and anal fissures. It can trigger a condition called Valsalva syncope, a dangerous sudden drop in blood pressure from sustained straining effort that can cause fainting. And in adults with existing cardiovascular conditions, the cardiac strain from aggressive and repeated straining is not trivial. The American College of Gastroenterology's clinical guidelines specifically identify this as a risk factor for cardiac events in older adults with pre-existing heart disease. Stop straining, breathe slowly, and begin the protocol I am about to give you. The third point is the one that stays with my patients long after they leave my office. This condition is frequently the visible result of a medication problem that has been building quietly for years. Let me name them directly: opioid pain medications, calcium channel blockers, certain antidepressants, iron supplements in high doses, antihistamines, diuretics. These are not obscure drugs. These are medications that millions of adults over 60 take every single day, and each one slows bowel motility as a documented and common side effect. When you are taking 2 or 3 or 4 of these simultaneously, the combined effect accumulates over months. It worsens gradually, and eventually it produces exactly what you may be experiencing right now. Count your medications right now. Mentally, go through your list. How many of the drugs I just named are you currently taking? Because the conversation you need to have with your doctor is not about laxatives. It is this: which of my current medications have constipation as a side effect, and what are our options? Write those exact words down. Take them to your next appointment. That single conversation may be the most important health decision you make this entire year. I want to pause here for just a moment. Right now, how many medications are you currently taking? Type the number in the comments. Just the number. You may be surprised how many people watching this share your exact situation. And every comment you leave helps someone else who is quietly searching for answers find this video when they need it most. After 2 decades of working with adults over 60 through exactly this kind of crisis, I developed something I now call the Clear Protocol. I want to give it to you completely right now, because it is the most important practical tool I can put in your hands today. It gives you the best possible chance of resolving this safely at home. And it tells you precisely when home management must stop and emergency care must begin. Clear. 5 steps, in this exact order. C. Cease all straining immediately. The moment you recognize this is an impaction, stop every straining effort. Rest. Breathe. Every additional attempt is working against your body, not with it. L. Lubricate and soften using glycerin suppositories. Available at any pharmacy without a prescription. For an established impaction in an adult, 1 suppository is rarely sufficient. Following established clinical guidance, 2 to 3 adult strength suppositories used simultaneously is appropriate. Apply water-based lubricant generously to each one before insertion. The surrounding tissue is already inflamed. Lubrication is not optional. It is what makes this step work. E. Elevate into position. Lie on your left side, not your back. Not sitting upright, your left side. This aligns with the natural anatomical curve of your sigmoid colon and rectum and directs the medication toward the impaction rather than away from it. That position is not optional. It is what makes the suppository reach where it needs to go. A. Allow time. Set a timer for 45 minutes and do not move from that position. Glycerin works through osmosis. It draws moisture into the hardened stool from the surrounding tissue. It lubricates the rectal wall. This process takes time. If you stand up at 15 minutes because you feel pressure, you will very likely expel only the suppository, and the impaction will remain exactly where it was, 45 minutes. Not 15, not 30, 45. Then walk gently for 15 minutes. If needed, complete a full second round. R. Recognize when to go. If 2 full rounds of suppositories and a warm saline enema administered with full patience at each step have not produced significant results, go to urgent care or the emergency room. This is not failure. This is the correct decision at the right moment. Desmond reached this point, and because he came in when he did rather than waiting another week, we were able to resolve his situation completely without surgery. Hospital teams have access to medicated enemas far more powerful than anything available over the counter. They have imaging to assess the full extent of what is happening, and if needed, a specialist can perform manual disimpaction under sedation, a procedure that provides immediate and complete relief. Every patient I have had who reached that stage described the relief afterward as something they will never forget. Alongside the clear protocol, there are 3 things I want you to begin today to ensure this situation either resolves or never returns. First, review your medications before your next appointment. Write down every medication you are currently taking. Bring that list to your doctor and ask this specific question. Which of these medications have constipation as a side effect, and what are our options? That list and that question together are more powerful than any laxative on the market. Second, hydrate deliberately and on a schedule, not when you feel thirsty, because after 60, your thirst signal is no longer a reliable guide. Set an alarm. Aim for 6 to 8 full glasses of water spread throughout the day. A warm glass of water within 30 minutes of waking has been shown to stimulate intestinal motility and is one of the simplest daily habits you can build starting tomorrow morning. Third, move your body every single day. Even a 20-minute walk creates gentle rhythmic pressure in the abdomen that naturally stimulates intestinal contractions. If walking is difficult, gentle chair exercises or light standing movements achieve a similar effect. Stillness is the enemy of a healthy colon. Movement is its most natural medicine. And if constipation has been a recurring pattern for you over months or years, please ask your doctor for a referral to a gastroenterologist. There are safe, effective, non-habit-forming options, osmotic agents, stool softeners, targeted motility support that are far preferable to long-term stimulant laxative use. Long-term stimulant laxatives can cause the colon to become dependent on artificial stimulation and gradually lose its ability to function on its own. Your doctor can help you build a sustainable plan, but only if you start that conversation. Let me bring every piece of this together for you now. Fecal impaction is not constipation. It is a hardened, dehydrated mass, physically blocking your rectum, and it carries real risks to your surrounding organs, your cardiovascular health, and your daily independence if it is left unaddressed. Overflow leakage is not diarrhea. Treating it with anti-diarrheal medication makes the impaction significantly worse. This is the mistake that turns a manageable situation into a medical emergency. Do not make it. Straining does not solve an impaction. It increases your risk of tissue injury, dangerous blood pressure drops, and cardiac stress. Stop straining and follow the clear protocol in order. Your medications may be the root cause. Name them, count them, bring the list to your doctor. Ask the specific question I gave you. That single conversation may be the most important health decision you make this year. And the clear protocol: cease, lubricate, elevate, allow time. Recognize when to go gives you a safe, sequenced, clinically grounded approach to managing this at home, and the clarity to know exactly when home is no longer the right place to be. I promised you at the beginning of this video that I would give you the one mistake that makes everything worse. I delivered that. I promised you a step-by-step protocol you could use tonight. I delivered that too. You came into this video without that information. You are leaving with all of it, and most people your age will never have it. You do now. Everything I have shared today is general medical information based on published research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Always consult your physician or qualified healthcare provider before making any changes to your medication, diet, supplements, or health routine. Before I let you go, I want to say something to you directly. Sitting through a video like this takes a particular kind of courage. This is not easy information to confront. It is not comfortable to think about your body this way. Most people scroll past. They tell themselves they will deal with it later. They minimize what is happening and hope it resolves on its own. You did not do that. You stayed. You chose to show up for your own health when most people would have looked away. And that choice, that specific decision you made today, is the difference between a crisis that quietly worsens and a situation that finally gets resolved. You now know what overflow incontinence actually is and why misreading it is so dangerous. You know why straining is working against you. You know the exact questions to bring to your doctor about your medication list. You have the clear protocol. You know when to stay home and when to go without delay. You walked into this video without a single one of those things. You are leaving with all of them. That is not a small change. That is a permanent shift in how you will protect your health from this day forward. Now I want to ask you to do one thing before you close this video. Think of one person in your life, a spouse, a sibling, a close friend, a neighbor, someone who has ever mentioned struggling with their digestion and brushed it off. Someone who may be going through exactly what you just learned about and suffering quietly because they do not have this information yet. Send them this video right now. Not because it is content worth sharing, because they are worth protecting. That is what this community does. We do not keep this to ourselves. If this video gave you something real today, please subscribe to this channel and turn on your notifications. Every week, I bring you the same depth, the same honesty, and the same commitment to giving you what your 15-minute appointment could not cover. And tell me in the comments, have you spoken to your doctor about your medications and your bowel health? If not, are you going to make that appointment this week? Tell me where you stand. The next video I am releasing covers something that almost nobody in this space is talking about: what happens to the colon of someone who has relied on laxatives for more than 1 year, and why stopping them suddenly can be just as dangerous as the impaction itself. If that surprises you, good, because most people do not find out until the damage is already done. Make sure you are subscribed so you do not miss it. Your body has been working for you every single minute of your life without asking for anything in return. The least you can do is give it the truth. I am Dr. Clifford Adeshina, and I will see you in the next one.